is just a huge honor for me today to be podcast interviewing Dr. Alex Dennis, DDS, PhD. He is a double doctor. He's a general dentist licensed in California and Minnesota. He received his dental education at the Dental State University in Romania, then became licensed as a foreign-trained dentist in California in 1999 and in Minnesota 2000. He has a PhD in computer sciences and uses high technology in every aspect of his daily task. For the most part of the day, his duties as a supervising dentist at Central California Dental Facility is taking care of complex medical dental cases of institutionalized patients. In the afternoon, he practices a few hours with his wife at Fresno Dental Studio, where he uses all technologies listed above with a main focus on 3D guided dental surgeries. Starting at the beginning in March, in the evening, he converted his office into a COVID-19 vaccination clinic where he provides free vaccines to community members, patients, and non-patients. Fresno Dental Scan 3D Dental Services and Cone Beam Dental Scans in Fresno, California. They provide several different levels of services meant to assist advanced surgeon as well as beginners in implant dentistry using advanced 3D technologies of a Gendex 500 high HD, is that high density cone beam computer tomography combined with intraoral scanning of the patient's dental arches, or CT scanning of models, or specialized scan appliances. They can provide the technology support and expertise you need to treat complicated cases. The keys to success is in proper planning that starts with acquiring correct data, understanding the patient's goals and surgeon's needs to design a computer-assisted design virtual treatment plan. Upon approval of the plan by your treating dentist, they can digitally mill or 3D print custom-made surgical guides to assist with placement of the dental implants. He is a general dentist with a morning job of supervising dentists with California Department Corrections and Rehabilitation, Central California Women's Facility. And his afternoon job is work in his wife's dental office with Claudia Dens, performing dental surgeries and 3D guided dental implant therapy. He's been practicing 23. Forget it. I'll just stop there, man. My God, you're a legend. I mean, you really are a legend. And I want to get to the point that I called you. You didn't call me. And what made me call you is you were all over the news, setting up vaccinations. I think you were the first dentist I was aware of that was vaccinating people. And I went to your website and I just thought, oh my God. So I reached out to you probably when all the media people were reaching out to you. But how did you, in the most regulated country on earth where everyone's leaving, were able to get to vaccinate patients?
Hey, Dr. Farhan, thank you so much for having me, first of all. And that was a long intro there. It was like almost you're not talking about me. You know, I guess I'm the guy that you're talking about, but I'll tell you about the vaccinations. So you're in Arizona, I'm here in California, and the governor of the state issued an order back in January allowing dentists to provide vaccinations, right? So following that, California Dental Association provided some training, but it was not a training that would have been, absolutely followed by enrollment in this vaccination program. You needed to go take some more classes from the CDC and then sign up with the California Department of Public Health. And it's a fairly lengthy process that then trickles down to your specific locality. Fresno, in my instance here, which is in Central California. And then after it trickles down to your local Department of Public Health, then they come and do a site inspection and they would approve you to get that vaccinations, to provide vaccinations to your patients. So it's a lengthy process. It took me about a month or so. And I got to tell you, at some points in time, I was so complicated, I almost wanted to give up. But I said, the community needs that. So I wanted to get that done, and I was able to succeed. And I've been doing it for about 5 weeks or so, I think. We're doing it every evening for about 2 hours and some Saturdays and Sundays. So it's going great.
Well, now, I don't like talking about religion, sex, politics, or violence. But you're in California, and I assume it's just because it's so controversial because it's such a big state. I mean, it's basically 10% of the population. In fact, it's the same as Canada. America has a Canada on the top. People got to think about it. 90% of Canadians live within 100 miles of the border. So even though the country landmass is bigger than America, it's just like a strip of 10% of America on the top, and California is 10% on the side. And it's just so big, I think it makes all the news. But the COVID response has been very controversial, I would say. But give us an update. It's right now, it's Easter. It's right before Easter. This is, what is today? Tuesday. And I don't know when this podcast will come out, but we're the Tuesday before Easter. What does COVID-19 look like right now, and how is it affecting dental offices right now?
Well, the way it's affecting us, I mean, other dental offices unfortunately had to shut down, and I doubt that they'll be able to reopen, But the ones that were able to stay afloat, and my office was able to, we purchased a lot of additional aerosol mitigation devices, such as air purifiers and other high volume evacuation that we use at the patient while we're doing aerosol generating procedures. So then we changed the way we see patients, see only one patient at a time. Being the fact that I work here with my wife in the office, most of the times we don't necessarily need to see more than one or two patients at a time. But I tell you, patients do appreciate not waiting. They actually never had to wait that long in my office, but now we even take it a step further, and we make sure that they don't wait or clutter in the waiting room before coming in the rooms to get their treatment done. And overall, they do appreciate it a lot. As far as the interest for the vaccine, I'll tell you that as well. I used a system to place automatic phone calls to all of my patients, and the response was terrific. We advertised the fact that, not advertise, just let them know the fact that we're providing vaccines free of charge, and they did sign up. And as a matter of fact, our schedules are full every day. I wish I'd be able to open more than just a week in advance, but we're always limited by the number of vaccines that the county provides us, which is a number that they decide on weekly. So we don't want to schedule too many people, so not to have to cancel their appointments, in other words.
I know you're a humble guy, but you're really, really, really smart. I mean, you got 2 doctorates, and my brother is he lives in Australia, and he was all bummed because the only one they got down there was the AstraZeneca, and he wanted the Pfizer, Moderna, BioNTech. You got 2 doctorates. If you were my brother, or when I first started hearing all these countries saying we don't want to take the AstraZeneca one, I thought, thank God, now the poor countries will at least have something, because all the rich countries had the money to buy up the total supply. And I knew if one of those vaccines wasn't as good as the other, the poor people would have a chance. But do you think you were probably given the Moderna or the Pfizer BioNTech? Those are like 94, 96% efficacy. But are you, what if my brother, AstraZeneca, is that one good enough?
I don't want to get into this and say which one is better than the other. I personally give Moderna, and then I've taken it myself. My wife took the other one, the Pfizer, but I do love, so I cannot compare the vaccines. I'm not studying vaccines or anything, but I do think that the technology that's behind the mRNA vaccines is pretty amazing. I mean, it's like a computer code that you shoot in somebody's arm, right? And it makes them make antibodies. And not only that it does that right now, but then it's like a computer program that you can tweak in the future, make a new vaccine, and have that cover or produce antibodies for this new COVID variants. I think it's something really cool. And that's why I think that both the mRNA vaccines are quite unique from that point of view relative to the others. But I'm not going to judge one against the other.
Yeah, I just think anybody should be lucky to give anything. Also, just to clear the record, just because I know you're a very smart guy, but You were born and raised in Bucharest, and I just want to make sure we're on the same page. That Michael Jackson's Dangerous Tour in Bucharest, Romania, in 1992, was the greatest musical event in the history of the universe.
Oh man, I missed that. It must have been, if you know.
Oh my God, that was the greatest musical event of all time. I think it might be the only live concert I've watched more than 100 times in the last 30 years.
Okay.
I mean, did you know it was in Bucharest?
I had no clue, but I'm gonna go maybe find a
Oh
recording of
my
that.
gosh, you must be a technical nerd geek. So now let's just jump into that was the reason I called you. You were giving these vaccines, and one of the things that's really irritating me about dentists is, I don't care if you lie to other people. I get real concerned when you start lying to yourself. And my gosh, all species lie. I mean, when an alligator turns himself into a camouflage, he's lying about that he's not there. I mean, all animals do these deceptive things. And dentists always have this chip on the shoulder that they're not a real doctor. Well, people say, oh, well, you're a dentist, you're not a real doctor. And I say, okay, well, the emergency rooms, 8.5% of the emergency room visits are odontogenic in origin because you guys are all closed Friday, Saturday, and Sunday. The real doctors are in the hospital. Number two, when you're treating a bunch of senior citizens, when great Granny Grunt doesn't make her 6-month recall, it's more likely that she died from the flu than from gingivitis, and you can't give a flu vaccine. But I go over to Walgreens, and it's not the pharmacy, it's a farm tech. They went to a 9-month program. They give all the flu vaccines. So the farm tech with 9 months of training saves more lives than all the dental offices combined. And finally, Tennessee was the first state that passed laws that said, well, hell yeah, a dentist can give a flu shot. Why the hell could a farm tech at Walgreens do it? And then when they legalize it, the dentist's like, well, I don't know. Why would I want to do that? Oh, okay. She's only 80. Yeah, go ahead and measure her gingivitis. Make sure she doesn't die of periodontal disease. I mean, man up, dude. Be a real doctor. And dentists should start giving flu shots and vaccines. The biggest one is oral cancer, and I can't even talk about it because it pisses me off, because I know 2 girls that went to ASU, and I know the dentist they went to every 6 months of their life, and they went to ASU and died from oral cancer, and no one ever suggested that the Guardian vaccine for HPV. So no, they didn't go to a real doctor. They went to a dentist, and I know who they are, and they're not real doctors, and their patients are dead because they were every 6 months looking for gingivitis instead of saying, hey, dude, this HPV is a real shit thing, and you need to get vaccinated, and I'm going to vaccinate, so they need to man up. And I hope the next generation, look at oral cancer. Oral cancer might be, maybe this MMR technology will get oral cancer, because I got more faith in an mRNA technology of beating oral cancer than any of my homies bringing up the Gardasil HPV vaccine, because this is what they say. Well, the problem is that some patients think that's related to sex. It's like, what? And you were what? An immaculate conception? What? You fall out of an oak tree? Did your mom and dad not do the nasty? I mean, you're either a doctor or you're a nut job. And sex is a real thing. Your parents had it. And, I think I was so proud of you that this thing come out. And whenever I see really unique out of the box thinking, you're not born in America. I mean, it's always the immigrants that come in here and freshen up all the stale people. It's always people who vote on their feet. For 500 years, the most motivated people on earth have been motivated to come to this country and build this great country. And what is their dumbass response? Build a wall, keep them out. And I'll say, what's wrong? And they'll say, oh, my small town, it's falling apart, it's all bankrupt. And I'll say, oh, tell me, didn't you have a factory there for like 100 years and it finally went bankrupt? Yeah. Who started that factory? Oh, I don't know. I'm like, dude, I just Googled it right now. It takes a 1-minute Google deal. And he came here from Armenia. It was 1912. He started this factory. You're whining about the factory's closed and building a wall. But that guy from Armenia, he couldn't even get here today. So you just can't fix stupid. And I was so proud of you that 2 doctorates, not born here, and we're already vaccinating people with the coronavirus. So, man, good at you, man. Good at you, man. You're just rocking it. But I know my homies, They don't want to think about that. But where you're really also killing it is you got 5 websites. You got FresnoDentalStudio.com, FresnoDentalImplants.com, FresnoSedationDentistry.com, FresnoDentalScan.com, and FresnoSnoring.com, which is, I assume, is a website about your wife snoring at night. I'm not for sure, but I assume that's what that's all about. But your Fresno Dental Scan, is that kind of a big deal where you're scanning other major cases and you're helping doing the workup? Or tell me about your 5 websites and which ones my homies should be paying attention to.
Well, yeah, the deal was, let me make a few comments on what you said before I get to the websites, right? So you said that only immigrants are motivated. No, that's not true. Or at least, yeah, I mean, some of them are, I guess. I'm one of them, but a lot of people could get very highly motivated to do the right thing in the community, and you don't necessarily need to be coming from a foreign country or be an immigrant to become motivated. I really would encourage anybody that wants to be involved in providing good care to the patients for free, right? So let me just make clear, this is free care. The fact that you're vaccinating them, you don't get a dime on it, right? Sometimes you end up spending money of your own to, like buy a freezer, buy a little fridge here to set it up, to close a room where you could otherwise make money by treating patients, to set all these things up for the vaccine. You stated that pharmacy technicians can do the vaccines and they're not dentists. True, too. I wish that dentists would be seen as part of the whole patient care of a patient, or of providing care to the community, and not only seen as a drill and fill kind of a guy. Well, I'm going to go to the dentist, he's going to drill my hole and plug it with a filling, right? Because I tell you what, and I do a lot of surgeries, and just dentists, by virtue of the fact that we're licensed to give shots in the patient's head, where you got blood vessels and all those kind of things where you could easily maim or kill a patient by not doing it right. I mean, if you can do it right in the mouth, I can promise you're going to be able to shoot that deltoid muscle there to give the vaccine. There's no, it's not hard at all. But okay, so it's good to go get all the training and everything to recognize an anaphylactic shock and how to treat it and all that. But it's nothing new that dentists don't know. We all know that, right? So now back to the websites you asked about.
Well, I got to make one. I got to clear up one thing about what you said. You're nice, you're sweet, and I know that and everything. But I'm not. I'm an asshole. And the bottom line is, when you look at math, and you look at all the IPOs on the NASDAQ for the last 50 years, what percent of them were not born in America? The CEOs of NASDAQ IPOs, what percent of them?
I don't know, but if you have that info, send it to me.
It's in the low 90s, okay? What percent of stem cell PhD students in America for math, physics, chemistry, and biology, stem cell PhDs in America are not from America? Okay. 90%. So over 90% of all IPOs in America were from people who weren't born in America. 90% of the people getting a PhD in math, physics, chemistry, and biology are not born in America. And I'll tell you another thing for dentists, close up. They'll come out of UAP, $400,000 of debt, or University of California, San Francisco, 2 dental schools in one city, $400,000 in debt. At 25, you come back at 55, every one of them still in debt, because they come out of school and they'll go buy a house and a car and a practice. They never cross over to debt free. They come there and they're from Asia, Africa, South America. They go buy a dental office. They don't buy a car. They don't buy a house. They live in the dental office. Their iPhones are deal. They work 12 hours a day, 7 days a week. And you come back 4 years later, they've paid off UAP, and they've saved up $100,000, and they still haven't bought a car yet. I mean, it's a whole different breed of cat. I mean, if you tell me you're born in America, you are lazy and entitled to a factor of 10 to anybody who motivated with their feet and moved from one side of the earth to another. And I mean, I can't find anything. And America always does the right thing when they've exhausted every other alternative. And when they get 23 trillion in debt and their economy's sunken and they finally, it's all over, they'll say, okay, open back up Ellis Island, and couple million people will move here. They'll all start the fresh blood, the factories, everything.
Well,
You can
yeah.
always count on America to do the right thing when they've exhausted every opportunity. There's nothing left.
Look, I'm not going to comment on politics or anything like that, but I'll tell you, I'm lucky to be here in this country. It doesn't matter where I was born. Yes, I was born overseas in Romania, but I'm lucky to be here doing what I'm doing, and helping the community that I live in right now here. And I think that anybody could really do that. But they got to have the will to get over the fact that, yes, it's free. And dentists tend to want to make a lot of money real fast, real quick, right? Partly for the reasons that you stated. Okay, some of them are in debt, whatever, This is nothing that's going to make you any money. The vaccination I'm talking about. And you know what is going to be over in the next 6 or 9 months anyway. But the good that you do to the community, it's immeasurable. I mean, I tell you, I have some patients and non-patients that come and they get the vaccines from me. They have tears in their eyes, and that's more than whatever they could pay me. That's the way I'm gauging it.
But the point I am making is the fact that you were motivated to leave your country, leave the Eastern Hemisphere, go clear on the other side of the world, that little economic barrier to entry separates you from 90% of people are never going to do something that dramatic. So just the fact that you did that makes you the type of person that goes and opens up a yogurt factory in 1912 that employed 2,000 people for years and years and years. So I think it's a litmus test. I'll tell you another litmus test that's proved out to be pretty interesting was bipolar. The head of John Hopkins Medical University, he was always irritated that the literature always said that America was 4% bipolar and Europe was 0.5%. And he goes, it's so all the people here are from there, and he goes that the majorities, and he goes it's so dumb. He says, why don't they just measure it correctly and we'd have the same? And it never happened. So finally he made it his mission to go over there and find out who's measuring this wrong, and they all figured out that they're all measuring it right, and they're 0.5% and we were 4%. And then it was the evolutionary biologist that said, well, who the hell do you think was the most likely to say, take this job and shove it, get in a boat where 1 in 8 sink, and sail across to the other side of the planet and start anew? Those are your manic, crazy people. When they go to Fortune 500, the 4% of the population, by the time you have $1 million in cash, it's something like 8. By the time you have 25 million in cash, it's like 10%. And by the time you have 100 million in cash, they're 25% bipolar. There's all kinds of yardsticks, but I think people that pick up and move from one side of the earth to the other are highly special people. They're very motivated, and if you're not afraid of picking up and leaving your country, look at dentists do. They come out of dental school and they're too afraid to start their own dental office. I graduated May 11 and had my dental office open September 21st. You know what these guys do? They come out of school and they go, well, it's scary to get in a boat and cross the ocean, so I'm just going to get a job and work. And I'm like, okay, well, that's a great idea. Why don't we go back 5 years, find all your classmates that went and got a job at Dock in the Box, and they should all still be working there, living happily ever after, and none of them are. And then you find out that they've had a different job every year for 5 years, and you're like, okay, well, if you just do an ounce of Google searching, you find out that this strategy never works. They hate it, they hate it, they hate it. 5 years later, they finally start their own. So why don't you just start your own? And they live in fear. And I think the immigrants are fearless. I mean, if you can pick up and leave the Eastern Hemisphere and come here by yourself, you're not afraid to start your own business. I think fear is a major problem.
Right. You're probably right.
Okay, so my homies know this. They know that dentistry is 200 years old. It started with Pierre Fauchard. Dentistry is a specialty of medicine. Orthodontics is a subspecialty of dentistry, which is a specialty of medicine, to get that cleared out of the way. I know if you ask your orthodontist, are you a dentist? He'll say, no, I'm an orthodontist. It's like, yeah, yeah, okay. He went to dental school 4 years and he can't even remember. And he can't read a history book that it was medicine. Dentistry is one of its specialties. They're a subspecialty. And so it's a very old profession. So it pretty much grows with the economy, maybe 1% above for cleaning, exams, x-rays. The only two areas growing double digit are the clearless aligners and align technology stuff and dental implantology. And so now go over your 5 websites because you got one of those is Fresno Dental Implants, and one of them is Fresno Dental Scan. And I know that's a real big motivating section for obvious reasons. If you go to London, Paris, and Tokyo, the government only gives you $100 for their socialized medicine dental plan for a root canal. So those cities, they don't do root canals. The doctors say, yeah, we can't do a root canal. We got to pull it and place an implant in a crown because that's not limited fee for the government, and they'll charge $1,500 for the implant and $1,500 for the crown and $3,000, which is what you have to do in Tokyo when ground is $1 million a meter. So one of the things I'm really big concerned about socialized medicine is the only thing I understand dentistry, it's an absolutely shithole disaster in every country that does this socialized, like the NIH in UK. I mean, if you dropped acid, you couldn't understand what that plan was trying to get you to do. So I know they're all interested in implants, and you're a big dog in this field. Tell us about that site.
Well, so I started doing implants about 10 years ago. And recently, I mean, not very recently, but about 4 or 5 years ago, I bought this Gendex HD cone beam CT scan machine, right? And I started discovering on my own, learning online about this 3D technologies and their applications in the dental field. I'm playing with different kinds of 3D printers. There is this great software that's actually free from Blue Sky Bio. So Blue Sky Bio allows you to import the DICOM images taken from a cone beam CT, superimpose that on the STL file that you produce by scanning patients intraorally, which I do in my case was a Trios scanner. I had some other scanners before. I had some Planmeca scanners, but in any case, at the end, the way I use this technology is that I show patients on a big screen TV that's connected to a computer. I show them their situation, and I show them what is it that we could do for you and the way we do it. And the more complicated surgeries, we like to fabricate some custom 3D printed guides. And I explain them what's the requirement of that is so that I can convert the plan that I'm showing them digitally in the software. I like to convert that exactly into their mouth. And I can do that only with this 3D printed guide. So they do get it. They appreciate it. First of all, when you put something on a big screen TV and you show them all the pathology, hey, you have this broken tooth, you got to take it out and put an implant. It's not hard to see when you put it on a big screen TV like that. And then when you also show them that, by the way, I do know how to fix that. And look, I have all these technologies in my office, you get the CT scan, I print you the 3D printed guide, and that's part of the surgery. Very rarely there is an extra fee. It's like the way I explain my patients is like, you go to the dentist, they take an x-ray before they do a filling. I got to take this CT scan before I do your implant. It's just as simple. I got to measure things in 3D before I screw an implant in there. And you really should, either you do it here or somewhere else, you got to ask the dentist to do something similar. That's how I go about it.
Okay, I know they get really, really serious when they got to buy something for $100,000. I mean, I see, in Dental Town, it's like a couple of different behaviors. Like, there's 250,000 registered dentists on Dental Town, 70,000 out of the app. We have several million downloads of the podcast just on the phone app. So we know they're going to the gym or they're going to work. There's 75 dental podcasts. And by the way, you guys can upload your dental podcast for free. And that's a huge section. But usually they just go to the today's active topics and just see, like last in, first out, the newspaper, what's going on. But man, if they have to go buy $100,000 CBCT, $100,000 CAD CAM, $100,000 Millennium Laser, they'll do a search for it and they'll stay there for hours. They come out of school $400,000 in debt. And these CBCTs are expensive. The first thing they're going to ask is, do I have to buy a CBCT to be an implantologist? Because when I go to the doctor and they're checking me for, I'll be 59 this year, so just basic stuff like diabetes, foot amputation, erectile dysfunction, dementia, just the normal things every 59-year-old has. They don't image anything in me. They send me somewhere else to get imaged, and you have an imaging place. Do you think a doctor coming out of school should buy an imaging thing? And before you answer, I want to say this. I got an iPhone. I mean, I've never hung on to an iPhone for more than 5 years. You're always upgrading it. But if you buy some $140,000 CBCT, you're going to want to get your money back, so you're going to want to own it for your whole 35 years. And what is that thing going to look like in 35 years? Something that Röntgen used in Germany? I mean, so that's a lot of questions, but how would you answer that?
Well, I'm pretty sure that with technology evolving at the pace that's evolving nowadays, that's all the stuff that I have here today, and it's pretty high tech and, latest specs that it is, I don't know, maybe 2 or 3 years old. In another 10, 15 years, or maybe even less than that, is going to be a piece of history in a museum. But if you want to do it right, do right to your patients, and be on the edge there of technology. I don't think you should be taking x-rays with the film, right? You want to fix cavities, you got to have at least a decent intraoral digital sensor, right? Same with this. And you don't need to have your own, but at least if you send it to someplace, send a patient to someplace, they'll give you this DICOM images, and then you'll use the software and know what to do with the data that you get back. Then you can make a great plan to the patient. You can get the patient to buy into the plan, and they'll really appreciate when you show that this is the stuff you know how to do, and that's how it's done right. And I personally, if a patient doesn't want to get a CT scan done, I'm just going to tell them, then we cannot treat you with dental implants, because it's just that simple. I usually have the fee of the CT scan payable up front at the time of the diagnosis and on the treatment presentation. And then if they want to do the treatment, then I would credit them back the cost of the CT scan as part of their treatment. So in other words, they don't end up paying anything if they end up doing treatment here with me. But if they don't, that's fine. I'll give them the DICOM data on a disc without the plan, right? Because the plan, you got to use your brain to do the plan, and I'm not going to give that away. I give them the DICOM data, and I'll tell them, okay, this is what you paid for. Take it away and go somewhere else. It's not a problem. Nobody should get upset about that. I think it's really the better solution for everybody.
You're doing so again. Go over your websites. You got Fresno Dental Studio. That's your B2C, business to consumer patient website, right?
Mm-hmm.
There's nothing there for my homies, right?
If you want to hook up and see what my wife does as far as aesthetic dentistry, yeah, you can definitely look that up and go on the Facebook webpage there.
So the next one's Fresno Dental Implants. Is that still the B2C site? I mean, the way I'm looking at this, that you have a separate B2B site from dentist to dentist, which is your Fresno Dental Scan. Is that right, or am I wrong on that?
No, Fresno Dental Scan, it's a website that's used
because that's the only one that says 4 doctors or 4 patients.
Yeah, because doctors could refer me patients to do just their scan.
Yeah. And is that a big growing part of the practice, or not really?
Not really, but I mean, I do a few patients a week.
Okay. Now, is that because that is your dental office?
Yes.
And, yeah. So that's what I found. And let's discuss that. When it'll be like a pediatric dentist, and he'll find some town of 200, or not 200, but say 25,000 people. And there's usually about a dentist per thousand in that town because the draw area in the rural is the size as the city. So a 25,000 population city will have another draw of another 25,000 in the rural. So it's really a dentist for every 2,000 plus. And somebody will say, wow, there's 25 dentists there. They don't have a pediatric dentist. I'm going to go there. But she goes inside another general dentist's office, and it's dead on arrival. The other general dentist won't do it. If she started her own, but she didn't have enough guts to cross the ocean or to start her own practice, it kills it. If you move that out of that office and Fresno Dental Scan, all the dentists in Fresno that could not trace it back to you and just thought it was a freestanding, it'd probably explode. But if it's inside your dental office, they think in fear. Roosevelt said living in fear is not an option. And Germany and Japan were the two biggest powers. And he said, tough, I don't care. We can't live in fear. It's not an option. And dentists, they live in fear their whole time. They live in fear of the dentist across the street. So have you thought about moving that out, like down the block and around the corner to not scare anyone?
No, I'm not going to rent another space or purchase a space just to put the scanner in there. It comes to an issue of trust, right? Dentists that refer patients here have to trust the fact that I'm not going to take away their patient. And as a matter of fact, I also work with a periodontist here in the office. And, when he gets his referrals, we're sending the patients back. He does whatever treatments he gets to do. Then we send them back. Same with this cone beam CT scans. Other dentists send their patients here. I want a cone beam because I want to take out, 17 and 32 or do some implants. I do the scan. If the patient even wants me to interpret what's in there, I'm going to tell them, no, you got to take this back to your dentist. I'm not your dentist. He requested that you get this kind of 3D X-ray done, right? And here it is on a disc, take it back to him. And I think it's just a matter of honesty. I mean, why would I steal someone else's patient? That's what all the dentists have to understand. You really have to be honest. Don't look at making an extra buck or two there by being dishonest, trying to get a patient from someone else. It's not going to get you anywhere. You're not going to advance in your career by doing that. What you're going to advance is by being honest and by providing great service to your patients. And they'll get to know you and want to come to you. And I think at least that's the way I'm doing it.
Yeah. Is your are you placing implants? Is that your main thing? I mean, is that kind of like your mini expertise in your office?
Yes, I do that. Surgical extractions. I work with a periodontist. He does a lot of connective tissue graft and other more complicated surgeries, all on 4, all on 6. So we kind of have this tiered system where, I might do some of the easier, and then he gets to do more of the complicated ones.
Yeah. And are you implant system agnostic? Or do you think, well, first of all, let's go back to CBCT. Are you CBCT and or implant agnostic?
Yes, of course I do. Just be more specific was the question exactly. What would you like me?
Well, the dentists are, in America's a little different in the fact that I want to start placing implants. So I want to buy a CBCT machine. Which one do you get? When they go listen to a speaker, I tell, like when people ask me what machine I recommend, I say, well, I'm going to teach you to quit asking speakers because they're all on the take from someone. And, I wish they dressed up like the NASCAR people so you could see the oil company and the gas company, you knew who they were doing. So you own a scanning company. And so I would want them to know, are all scanners equivalent? Is there a certain scanner you like? And then since you're a double doctor and you place implants, I mean, there's a lot of implants. There's Noble Biocare. And then the same companies like Danaher didn't thought they were overweighted in dentistry, so they spun off dentistry, but they own Noble Biocare and the high end and Implants Direct. You look at Straumann, the largest dental implant company publicly traded, they own a high end Straumann implant and the low cost value Neodent. But a lot of dentists in America are saying, God, I'd sure like to buy the Neodents and save some money on the Straumanns. So that's what I meant by, are you implant agnostic?
Right. So let me answer first the cone beam CT. I had some experience with Planmeca. I didn't own one, but I did use it prior to purchasing this Gendex HD. It just has to do with, what's your primary purpose of using it? And for me, it's scanning dual arch. So I need to have 8.5 by 8.5 centimeters field of view, right? I think it's 8.5 by 8.5 by 11 at I forgot the voxels. I think it's yeah. In any case, it's a 20 voxels, right? So I need to have a reliable scanning solution and enough accuracy and resolution to see both arches and see it enough, good enough for placing the implants, right? I don't need to see that accessory canal in the mesial buccal of number 3 or number 14. I'm not an endodontist, right? If you want to get a cone beam CT to aid you in doing endodontic treatments, then you got to look for a smaller field of view of a higher resolution, right? So I'd prefer, or I would recommend, without recommending any particular brand, if for somebody that wants to get into implants, to look at something that has a field of view that would allow them to take a dual arch scan with the patient's mouth open a little bit out of occlusion in just one shot. And I find that to be the best.
Now, since your wife is a dentist, you guys met in Romania, right?
Yes, we did.
You know, a lot of time, I think the best strategy is if what I don't understand is there's two dentists in office. There's 168 hours in a week. The most obvious thing is that one dentist should work, Monday, Tuesday, Wednesday, 3 10-hour days, and the next one should open Thursday, Friday, and Saturday, 3 10-hour days, because we know from the only 3 publicly traded dental offices on earth, one in Melbourne and Sydney, another one in Sydney, Australia. I think Sydney's got 300 dentists, and Melbourne's got Pacific Smiles, then a big one in Q&M in Singapore. They're all open 7 to 7, 7 days a week, and that's what will get you to enough profit dollars to be publicly traded. But I'll go in there and it'll be 2 dentists, and they both work Monday through Thursday, 8 to 4. They don't extend any of the patient hours. So not covering more hours and not having an overlap would be the first obvious. And then the second thing you would think, okay, well, one will go blood and guts, extractions, endo, and implants, and the other one will go soft and pretty, bleaching, bonding, and clear aligners. And you can always tell in dental school after their first endodontic x-ray which way they're going, because if they're a pulp lover and they're staying like a 0.5 millimeter from the apex and they don't want to violate the pulp, they're going to be into bleaching, bonding, veneers. But if they're like me, an apical barbarian that just blows through the apex and wants a puff of sealer out the end, they're going to love blood, extractions, endo, all that kind of stuff like that. So did you do that, dude? Did you go blood and guts implants and your wife went soft and pretty, bleaching, bonding, and veneers? And were you still 32 hours out of 168 hours isn't even a 19% utilization of your fixed assets, rent, mortgage, business, build out, computer, insurance, malpractice? Did you expand your hours for the consumer and go different directions, or are you just overlapping each other?
No, actually, yes, I'm the blood and guts dentist, and Claudia, she's the one with the veneers, the nice composites, and the full mouth reconstructions that take a lot of patients' expertise and training. She's also a mentor at Frank Spear Study Club.
Right here in my backyard.
Yeah, exactly. Right there in Arizona, while I do all the surgeries, right? And it's not a matter of adding hours. You got to look for increased profitability, which for the most part has to do with the right planning, minimizing the redos. I don't think we ever have any redos or hardly at all, if any at all. But it comes from having the right plan from the beginning, getting the patient to understand the plan and sign up and get the compliant patient that wants to follow through with the entire treatment. And it doesn't mean that they have to pay all at once in advance. You can design a treatment that could last for a year and kind of flow with the money that the patient is willing to put into this. So we did not expand the hours. In fact, I personally decreased my hours, because like I told you, I have a morning job somewhere else from 7 to 3 o'clock in the afternoon. I work for the California Department of Corrections and Rehabilitations, not that far away here from Fresno where I live. And I do practice dentistry and a lot of surgeries there that I do. But I come in the evening and do about 2-3 hours every day here in my office. So that's about 3 hours times 5, 15 hours a week. Not a whole lot, but if you know what you're doing, you don't need to waste the whole day just waiting for the patient. My staff, and I'm very grateful to my staff, they are willing to participate and learn all these technologies that I've implemented in my office. And my staff could just take the cone beam CT of the patient, that I can take a look at that in the evening, call up the patient, present remotely if I need to. I don't necessarily need to have the patient in front of me, especially in this COVID age. I'd present remotely and then, get the patient to understand what is it that we want to do for them. And the next time I'll see the patient, I'll already have the plan, and it's just a matter of execution. So I think it has to do with having a better flow and increased profitability through the use of technology, not necessarily putting in long hours. I'm not a fan of very long hours. I want to get home and get to do my own things.
And I know that we had another person on just not very long ago on the subject of crystal meth, and she got her expertise at a prison, and I wanted to talk to her about that, and she said, like everybody that works at a prison, she says, I can't talk about it. I work at a prison. It was in San Francisco. Hang on real quick, let me see what episode that was. Ronnie Brown, episode 1473, but she doesn't want to talk about the prison stuff. And you work at a prison place, so I already assume you don't want to talk about that either. Is it just something in the HR manual, or?
No, it's not a secret, but I mean, I cannot talk to you about what is it that exactly we're doing there or how we. The only thing I can tell you is that so I'm here in California, right? It's called California Department of Corrections and Rehabilitations, and I can tell you that there are very, very sharp people working there, right? And you got to get over. I mean, dentists have to get over this. Preconception that if you work in a prison you must be a bad dentist. Actually, I think it's to the contrary, right? You got to be a top-notch dentist, know how to deal with a medically compromised case, know how to do surgeries. And I can tell you, CDCR has been, and it continues to be, at the forefront of using technology both in dentistry and in the medical field, right? We do have access to patients' chart and information that's so much more readily available than it's to a dentist in the community, treating a patient out in the community. As a matter of fact, the deal with the vaccinations actually started there in CDCR first, right? Because they were first to implement, getting help from the dentists to vaccinate both staff and patients. And when I started doing it there, I said to myself, this is great. It just makes sense that I will do it in my office as well. So I ended up doing it, so it's a great place where you need to have a lot of surgical experience. And actually, you do learn a lot, seeing a lot of medically compromised cases that otherwise you wouldn't see anywhere else.
And do you have the? I think the funnest thing about anything is group practice. I started with a solo, and you leave dental school, you have 120 alcoholic drinking friends, and then the next thing you know, you wake up and you're all alone. And it only took me like 6 months to decide this isn't fun. So I hired an associate, and I was so young and dumb. I hired someone just as young and dumb as I was. In fact, he was 1 year younger than me. I should have hired some older person, but I see group practice. They're just happier. They have more fun. They have less fear because if I go try something and I get stuck, you can look at it, together, and then when that goes to a second location, that now you're group practice multi-location, and that's what a DSO is. I mean, it's just group practice multi-location. But is working in the prison system fun because you have colleagues in there, and it's kind of like group practice mental stimulation?
Of course, that's exactly what it is. And then, you learn, you study as a group, you discuss about cases, and then, you either myself or someone else will end up doing the case, but you learn through a shared experience, right? Through shared experiences and discussions of the cases. And I think that's great. In the community, unless you run your own study club, it's a little bit hard to do that because everybody, like I said, it's hunting down for an extra buck or two, while treating patients in state institutions, it's not like that. It's just about delivering the best care you can to the patient.
Yeah, I agree that that they just have more fun. And then when you look at the other end, the dark end of the spectrum, where the dentist is showing up to work drunk and drinking Listerine and all that, nobody in the staff stands up to him. The next thing you know, they're all crying at a funeral. But in a group practice, you can, it takes a dentist to walk in and say, "Dude, you can't do that. We got to go do something." You know what I mean? But absolute power corrupts absolutely, and I think that 5,000 years of history showed us that we need transparency and checks and balance competition. And it's usually the checks and balance competition that when someone says to you, "Alex, come on, dude, you did not cement that." No way. Look at the x-ray. Dude, I'm going to go cut it off right now. They go into the hygiene department and they tell the hygienist, "Yeah, we need to redo that number 30 because that has an open margin." And she's sitting there thinking, "Dude, the last 3 crowns you cemented had open margins that big." But they're afraid to say something. But in group, it's just, I just think it's a much healthier environment. So,
Of course.
yeah, so you agree with that? So
Absolutely.
I want to get personal though with you for a little bit. A lot of people are afraid to work with their spouse. They're like, "Man, I can't work and live with her and blah blah blah." And they're coming out of school and they go, the number one goal of a primate is to find another primate and mix gametes. And that is the main priority of all species. And our species gets an A plus. And I mean, this herd of Homo sapiens drops 300,000 babies a day. I mean, no problem. But what advice would you give? A quarter of our viewers are in dental school. And there's probably 2 little lovebirds giggling and listening to this thing. And they're like, should we set up together, or is that just batshit crazy? What advice? How long have you been married to Claudia?
For about 25 years.
25 years. And
Right after we finished dental school.
but what advice would you give to little lovebirds in dental school? A quarter of our listeners are still in dental kindergarten school. They're in love and they're going to come out. You guys work together. In fact, you went to another country together. Holy moly. I want to meet your mother-in-law. She scared you all the way to the Western Hemisphere. But what advice have you picked up over the years?
You're right. Was the mother-in-law, by the way? But
it was the mother-in-law. Are you
here.
kidding me? I guessed it. Yay! Root.
So I'll tell you. What advice I'll give them. First of all, is be honest to yourselves, and this is not an easy job, right? It requires a lot of patience and devotion. It requires a lot of attention to detail. But right now they're already in dental school, so they must know all those details. It's great to practice with your wife as long as you don't get on each other's nerves, and you do things, different things, maybe within the office, like I'm doing with Claudia. I'm doing the surgery, she's doing the others. Don't try to criticize your spouse. No person is the same like another, right? So there are always going to be differences in the way you see treatment plans, execute treatment plans, or attend to patients' care. rather than doing destructive things like that, work jointly, to use your joint experience and knowledge to provide the better service to the patient. For example, I'm more geared toward the computers, so I like dealing with all the CT scans and the planning and all that. But then if Claudia wants to put an implant, just go for it. I mean, I'll help her as I would like her to help me when I'm doing, I don't know, some veneer preps or things that I'm not maybe so good at it. It's just a constant learning process. If you go into the dental field and think you're going to open an office, that's great. Good luck. Just count on the fact that it's going to be a lifetime experience and a lifelong learning process. What I like to also advise them is to embrace technology. And that doesn't necessarily mean, sit there on Instagram all day long or gossip on Facebook, It's things like this, like intraoral scanning or 3D intraoral scanning for digital impressions or cone beam CT, make guides, make things that really would advance your skills. And as a matter of fact, about advancing your skills, challenge yourself and work a little bit outside of your comfort zone. Every time you do something, think about how you would do it in a little bit of a different way next time, and maybe challenge yourself to do a tougher case next time. So I think that's how you learn. It's if you think that 10 years after you graduate dental school, you're going to practice the same way as you learned it in the dental school, then you'll be history and nobody's going to want to come to you. So be forewarned about that. You got to keep pace with this ever-changing technology. And dentistry, I think it's one of the highest end technology fields nowadays in healthcare.
Okay, so this is Dentistry Uncensored, and I don't want to talk about anything everyone always agrees on and all that kind of stuff. And I want to ask you a question that's going to get you in so much trouble. You'll never talk to me again. But when I look at the research, one of the things I noticed starting up is the total health of this person, and they'll come here. I'm across the street from the Guadalupe Indian Reservation where they have 25,000 Hispanic, Mexican, Native American, Indian, and not one dentist in there. And they come in there, and it'll be a second molar, and they'll want to save it. And root canal bill and crown's like $2,000. So I saved it. This is back in the 80s. And then they come in next year, and another one needed it. And I thought, well, why did I take out the whole $2,000 annual budget for this guy? I should have pulled number 2, and I should have done all of his fillings, and then he wouldn't have had a cavity. And now he wants to save this one, so then I do it again. I take another $2,500 and do a root canal, build-up, and crown and save another one. And I'm starting to think that when I look at the studies that 90% of the occlusion is first molar, second bicuspid. I mean, it's all over the research. And I'm certain we pull wisdom teeth just because we don't even like them at birth. I mean, they're just born bad. I mean, the oral surgeons just take them all out. But the question is specifically, if you're in California, it's there's all kinds of diversity and poor and immigration. If you had an immigrant come in that was picking fields out there in Fresno in the grapevines and all that, and he had $2,500, and you could either replace number 2 that was pulled with an implant and a crown and a bone graft and all that stuff, or you could do a dozen other cavities, but he could only pick one. What do you think is more valuable for this 25-year-old male immigrant farm worker?
Well, that's a tough question because it all depends what's the reason why I'm going to take out number 3. Is it because it's so bombed out that the guy is in pain? I mean, I like to do that to get him out of pain, but I also like to do something that would kind of go hand in hand with his dental education that, by the way, I would try to improve his dental IQ, right? Tell him, hey, you got to brush your teeth and do all that, so you don't have cavities on all of your teeth. But I'd probably take the tooth out, maybe not necessarily with the bone graft and all that, because the guy is not going to have the money to put an implant, and then I'll fix some of those cavities. But I'll tell him, you got to start going to the dentist, and this is how it's done, and you got to come back and let's fix whatever is more urgent, right? So, urgency for patients sometimes, most of the times in their head translates to pain, right? Well, if it doesn't hurt, it must not be urgent. Well, actually, it is. Some of them that don't hurt could be more urgent than other little things that hurt. You can have a recession on the tooth that hurts, and it's not as urgent as a tooth with a chronic periapical periodontitis, that's close to the sinus and could cause you a sinus infection and a oral-enteral communication, right? So fix that first, even if it doesn't hurt. So I would try to get them to understand that the degree of urgency does not relate to the level of pain, and then treat whatever the patient wants ultimately, but I would suggest a priority list for them.
Interesting. And last but not least, my gosh, I can't believe we went over an hour. That was the fastest hour I've ever done a podcast ever. But what was there anything that we didn't talk about today that you were hoping that we were going to talk about?
For the new dentists that think they're going to open their own office, I wish them good luck. It's not a very easy endeavor, and you're going to be in this for the long haul. Make sure you pick great staff members. My staff members have been awesome to me, and I cannot thank them enough for helping me with all the crazy ideas that I had, from scanning patients extraorally with the cone beam CT, intraoral digital impressions, printing 3D guides, everything. And I started from like the oldest of the old technologies, started from a Cerix 3D way 10, 15 years ago, I think that was. But just pick great staff members. They really believe in you, and train them well. And it's a long-term commitment that you have to your staff. And unfortunately, there are sometimes staff members that don't fully represent you and your office in front of the patients. And if that's the case, train them more, ultimately replace them if it doesn't work by training them. But just know that the staff that you have could make you or break you, so to speak, right? So always keep that in mind.
And I just want to thank all the immigrants that came to dentistry. You're not the first, second, third, or even fourth podcast I've done from a Romanian. Fearless Dentistry, episode 400 with Delia Tuttle. The next is Should You Place Dental Implants with Minia Kafadara? And then another one is a big-time lecture, Miladadinov Milos with dental photography.
Yeah, he's a dental technician. He's doing a lot of dental photography, and I've taken his classes. His classes are really nice.
And you're number 4. You're the 4th Romanian dentist, and again, the greatest musical event that I'm not even kidding. I'm not even making this up. My mom and I will never see eye to eye on anything. She thinks Frank Sinatra is the greatest musician that ever lived, and I have to educate her that it was Michael Jackson in Bucharest, Romania, in 1992 on the Dangerous tour. I mean, that is absolutely the biggest musical event. It sold the most albums. It broke all the records. I mean, if you said it's Frank Sinatra, you don't have a data leg to stand on. And, we're either going to go data driven or we're just going to talk smack. But
all right, hold on. Let me add one more thing before you go. Okay.
Okay.
Thank you so much for your time, Howard. I like to add one more thing, because we're talking about the vaccines and all that in the beginning, and that does not translate in making the dentist any money. But either become involved in the vaccines or whatever, this is going to be over, hopefully, soon. I mean, I don't know, 6-9 months or so. Become involved in the vaccines if you can, but if you can't, just help your community. If there is a guy that comes and he's in pain and has got no money, treat them well. Because the likelihood for them referring you patients in the future, becoming a good future patient to you, it's exponentially increases if you treat your patients nice. And be that a vaccine or some free treatment here and there, it shouldn't break the bank.
And I want to end one thing on that. I agree completely. That's so well said what you just said. Hustle. I remember that it was the first time someone told me that at the end of the year, it was 87, at the end of the year was a good time to everyone that went over your 30, 60, 90, and 120 account receivables is to turn them over to a collection agency. And I thought, really? I said, that's kind of weird because don't these people live like within a few miles of your office? You're going to turn them over to a collection agency. And then I said, well, what percent of the money do they collect? I mean, do they collect 70, 80, 90%? And they go, nah, it'll be like 5 or 10%. So I'm like, oh, okay. So I'm not going to get 90% of my money, and I'm going to really piss someone off that lives like a mile from my office. So I did the exact opposite. I mean, usually if everybody says, do this, you got to take a serious look at the other direction. And I sat there and said, well, you know what? It must suck to be in this situation. So I went and got some greeting cards, and it was at Christmas time, and I did it every year. I said, with the spirit of Christmas around the corner, my gosh, I just want to tell you that I had a great year. And from people like you, I had a really great year. But obviously, you did not have a great year because I'm looking at your, you haven't made a payment. You stopped paying us. So obviously, something went wrong. So with the spirit of Christmas around the corner, I have written off your bill. Here's the receipt. You owe me nothing. And all I ask is that you continue to refer your friends and loved ones to me, blah, blah, blah. Oh my God, they'd show up crying and tell me the horror stories, and they'd tell me what went wrong, and they'd make me, I mean, it was like the best PR move I ever made.
That's awesome.
And it shows you, like, a lot of people think the homeless people are all, working the system, whereas I've had people on this podcast. What's his name up in, Kyle, the guy up in Globe, Arizona? Chris Volchek, who's been doing the homeless shelter for 35 years in Phoenix. I've been doing dentistry. He says, dude, 90% have schizophrenia. They're not milking the system. They're schizophrenic. And so the bottom line is, if your only option is violence and mean and whatever, probably just do the opposite. And when some kid comes in and they don't have any money, it's also a great time to, if you're learning how to place implants, well, if you're trying something new, just find someone to do it on. Yeah, they need more experience in endo, but they're kicking out root canals because they didn't pass the financial arrangements. Like, okay, you're all complaining that while in dental school, you didn't have enough because of the COVID-19 that you weren't able to do, 15 canals of endo like you and I did to get out of school. A lot of them haven't even done 2 canals, and a lot of them only did a couple on extracted teeth. And then they come out of school, and this guy is too poor to pass the financial arrangement, so they kick him out. It's like, dude, in dental school, you would have paid $100,000 a year to do that root canal. Right. And now you just kicked it out. And why didn't you say, look, yeah, you don't have the money or whatever. So, the bottom line is, intentions are everything. Have a good heart, help other people, and you'll make your own luck.
Yeah, I'll continue doing that. Thank you so much for your time.
Oh, thank you so much for coming on the show. It was just an honor to podcast you.
All right. Thank you.